India has a tribal population of roughly 11 crore, which is just under 9% of our population. But did you know that child malnutrition is 50% higher in tribal population than other populations? Or 65% of tribal women suffer from anemia in the age group 15 to 49 years. Tribal people in our country unfortunately are amongst the poorest and have little or no healthcare facilities. But then there are doctors who have dedicated their life for better health and upliftment of the rural and tribal communities. On World Health Day, on the Banega Swasth India campaign special show, we salute these doctors whose services to the community are nothing short of pioneering. Our story begins from Dr. Rani and Abhay Bang in Gadchiroli, Maharashtra. Inspired by Mahatma Gandhi, Dr. Abhay and Rani Bang chose to work in Gadchiroli that lies in eastern Maharashtra, 200 kilometers from Nagpur, borders Chhattisgarh in the east and Telangana in the south, where healthcare was an urgent necessity. As co-founders of Society for Education, Action and Research in Community Health, SEARCH, their mission was to serve rural communities by improving the quality of healthcare.
It was sheer my good fortune that I was born and brought up in and around Mahatma Gandhi's ashram in Wardha district. I think the exposure to Gandhian philosophy and villages at that time inspired me to become a doctor with a specific purpose, how to improve health and healthcare in rural areas, rural India. My wife Rani and I, we decided to select Gadchiroli for our future work. The reason being, this was a newly carved out district in Maharashtra, carved out because of its backwardness, because it was largely inhabited by tribal population, and that's why we decided to come to Gadchiroli in 1986 and started this organization which we named SEARCH.
Our purpose was to serve the most underprivileged and disadvantaged people. So we thought that whatever we have learnt in our medical curriculum and at Hopkins, we should make use of it in this area where there are no other health services like clinical services, other services. You won't believe, but I did the first cesarean section in this district.
In order to be responsive to the cultural sensitivities of the area and to create a tribal-friendly space that wasn't intimidating, the Bangs Clinic, set up in 1993, was modelled on a typical tribal home. Today, Shodhgram not only houses the Ma Danteshwari Hospital, but also a temple for the tribal deity whose blessings are essential for healing. It is their home, research campus and the quarters for their voluntary organization SEARCH.
How to provide care, so we thought of naturally hospital. We collected tribal people from 50 villages and we asked them, what sort of hospital would you like to have? Why don't you go to government hospitals? They said, we are afraid. We are afraid of big buildings. We are afraid of white coats. We are afraid of the language that they speak there. They laugh at us. So we realized that if we want tribal people to seek care, not feel shy, not feel afraid, we need to build a tribal-friendly hospital. We created a temple of their goddess. Their goddess is Danteshwari, and that's why this hospital was labeled by tribal people as Ma Danteshwari Dawakhana.
Tribal communities in our country have poorer health indicators, greater burdens of morbidity and mortality, and very limited access to healthcare.
When I look at tribals, I always wonder who is more civilized. We say they are illiterate, they are ignorant, they are superstitious. In tribal culture, there is no dowry, and so there is no dowry death. In tribal culture, there is no theft at all. Nobody locks the houses. All the villagers are in the forest for the whole day. There is no sexual abuse, no sexual violence against women in tribal culture. This rape and all that is not seen in tribal culture. So now you tell me who is more civilized, they or us?
The 100-bedded hospital provides both outpatient and inpatient care services for primary health care and severe illnesses requiring hospitalization. Surgeries are conducted with the help of volunteering surgeons and anesthetists in a well-equipped operation theatre. It has a pathology lab, a pharmacy selling low-cost generic medicines, and an ambulance service for remote tribal areas. The Bang's innovation in home-based care of newborns does not depend on doctors, nurses, hospitals, or costly equipment. It empowers women to use simple medical knowledge and skills to save their newborns. Anjana is in her 50s. She's a Gondi tribal and lives in a village called Bodli, 5 km from the Gadchiroli district headquarters. She is an accomplished community health worker called an Arogya Doot, who could be a national example of how a frontline health worker should be trained and put to use on the ground.
हमारे गांव में सर से कई लोग आए थे। उन्होंने पुलिस पाटिल और सरपंच को बताया, पढ़ी लिखी, उनको लिखना पढ़ना आता है और उनकी शादी हुई है और उनको बच्चे हैं, ऐसे महिला को हमको नाम बताओ। और मेरे लड़के को बार बार डायरिया होती थी, मुझे पता ही नहीं था वो डायरिया नहीं होने के लिए क्या करना है और हो गया तो क्या देना है, ये पता ही नहीं था। अभी तो जब सर से मैं जुड़ी और डायरिया और कौन सा भी आधार नहीं होना चाहिए तो इसके कौन सी काळजी घेना चाहिए और हो गया तो कौन सी औषध देना है, ये अभी तो मेरे को सब मालूम अभी हुआ है।
मैं धानोरा से आई हूँ अपने माँ बाप के घर डिलीवरी के लिए, और अंजना दीदी हमारे घर आती थी और बच्चे को कैसे रखना है, दूध कैसे पिलाना है, अपना सेहत का ध्यान, बच्चे का ध्यान कैसे रखना है, ये सब बताती थी।
Over the years, Search has trained 39 women like Anjana from 39 villages in Gadchiroli in home-based newborn care. The doctor couple is known in the medical fraternity globally for their groundbreaking research. In fact, the journal Lancet has honored them as the pioneers of healthcare in rural India.
I designed this home-based newborn care in 1990, started implementing it in 1995, and Search developed a team really for implementation. We selected 39 female community health workers to work as Arogya Doot. So the Arogya Doot, the mother, grandmother, and at that time there were dais in the villages, dai. These four kind of women became the main pillar who provided the newborn care at home. With this approach, newborn mortality in 39 villages where we introduced reduced by 62% within 3 years.
Women have so many gynecological problems, and to my surprise I found that 100% of the women put obstructed labor and infertility in the most serious disease category. So I asked those rural women and tribal women, why did you put these two together? And these women gave me such a wonderful reply. They said, Madam, if there is obstructed labor, that lady dies only once in her lifetime. But if there is infertility, she dies daily, because everybody blames her for her infertility problem. So I did the first community-based study of gynecological problems in rural area in Gadchiroli, and I showed that 92% of the women had gynecological problems and only 8% of the women had ever sought any care for gynecological problems.
7-year-old Nandini has type 1 diabetes. Her village, Horkasa, is in the remotest part of Gadchiroli and lacks public health infrastructure. So regular visits from the mobile medical unit make it easier for the family to monitor her sugar levels.
जब गाड़ी आती है ना हमारे गांव में, उसका वजन, शुगर, बीपी सब उसका तपासनी करते हैं और उन्हें बताते हैं कम है का ज़्यादा है, उसको हम बताते हैं अपना आई बाबा को। हम लोग उसका बात मानकर हम उसको गोली खिलाते हैं।
ये ट्राइबल एरिया बहुत इंटीरियर है, तो उस वजह से सब सेंटर या कुछ हेल्थ सर्विसेज से वहाँ पहुँच नहीं पाते। उस गांव तक हम यानी मेडिकल यूनिट जाते हैं। साथ साथ में ही हम गर्भवती माताएं, पोस्ट प्रेगनेंसी
उनकी भी हम देखभाल करते हैं। और अंडर 5 तक जो भी बच्चे आते हैं उनको स्क्रीन करते हैं, उनका माल नरिशमेंट तो नहीं है, उनको और कोई निमोनिया और डिसीज तो नहीं है, ये भी देखते हैं।
The principles of Gandhiji are still in place in Shodhgram today, with community Shramdan practiced twice a week.
यहाँ कम से कम हम लोग 150 लोग यहाँ रहते हैं, तो कम्युनिटी बॉन्डिंग उसमें से आता है। तो ये सारी चीज़ों को देखकर श्रमदान हम लोग यहाँ पे हफ्ते में 2 बार सुबह करते हैं। सबसे बड़ी बात मैं ये कहूँगा कि सर्च एक्चुअली गांधी जी की फ़िलॉसफी पे बेस्ड है, और एकादश व्रत में जैसे शरीर श्रम के ऊपर ज़्यादा भर दिया है गांधी जी ने, तो वो शरीर श्रम का हिस्सा भी हम लोग श्रमयोग को देखते हैं। हम उसको श्रमदान नहीं कहते, हम उसको श्रम योग कहते हैं।
Search's activities have now expanded into the areas of non-communicable diseases, tobacco and alcohol consumption, adolescent reproductive health, life skills education, and initiating a Youth for Purpose initiative. Dr. Rani and Abhebang have revolutionized healthcare for India's poorest. From their pioneering work on infant mortality to path-breaking research in gynecological and sexual diseases among Gadchiroli's women, the Padma Shri awardee couple, immense contribution in the field of medicine has changed the face of healthcare in this part of Maharashtra. Coming up after this break, we travel to Sitlingi Valley in Tamil Nadu, where we meet another couple who has worked for 30 years with the tribal community, not just on community health, but also economic and social health. From Maharashtra's Gadchiroli to Tamil Nadu's Sitlingi, Dr. Lalita Reggie and Dr. Reggie George have transformed the health of the tribal communities in the Sitlingi Valley and the surrounding mountains in the last 29 years through various projects in healthcare, community health, farming, as well as handicrafts. The couple pioneered the Tribal Health Initiative, where their aim was to empower the tribal villagers where they could take care of their own health. In 29 years, Tribal Health Initiative has grown from this. To this, an ISO certified hospital for quality medical care, which boasts of modern facilities like an advanced intensive care unit, a dental clinic, a labor room, a neonatal room, a well-equipped emergency room, and a fully functional laboratory. It all began when Dr. Lalita and Dr. Reggie came to a completely neglected tribal village in Dharmapuri district, 125 kilometers away from Salem in Tamil Nadu. A place where healthcare at the time means quacks and black magic.
So as soon as we finished studies, we started working in a place called Gandhigram, which is near Madurai. This is the Gandhian institution, and we worked there as clinical doctors. Our 5 years there helped us to get in touch with people who had actually worked with Gandhi. So a lot of our work is based on Gandhiji's inspiration. Me and Lalita look for the most, to a place which is most farthest away from healthcare. And that's how, after a little research, we ended up in Sitlingi. We fell in love with this place because it's full of nature, and it was populated about 95% by tribals.
We have always wanted to work in a place where we are wanted, where there are no doctors. So we looked at so that was a common dream which both of us had from the time when, even before we met.
The people here were very friendly. I don't think they believed that we were doctors who wanted to work here, because the only doctors they had seen were in the occasional films, and gradually over the years they accepted us as doctors because they found that they could come to us with any illness and we could sort of cure them. So when we came here, we actually had no money. So we just took a piece of government land, encroached on it literally, and the people here built us a small mud and thatch hut. which for the first 3 years was our hospital.
When we came here, there were mothers dying in childbirth, and then the infant mortality was 147. But the thing is that the change was done by the community, and we had a group of women, my generation, many of them older than me also, whom we called as health auxiliary. They started working. They are all farmers, and they started working voluntarily in the village. And they looked at just 3 things. One is the nutrition and how to prevent malnutrition, or if it comes, know how to treat it. Respiratory infections and diarrheal diseases. And these 3 put together were the major causes of infant mortality and under 5 mortality. And they also looked at how to have safe deliveries. In early 2000s, they brought down the infant mortality to 20 from 147.
Today, THI's dream of providing affordable and acceptable basic healthcare services spans 33 villages in the Sitlingi Valley and the Kalrayan Hills. It is an approach that seeks to help the tribals help themselves.
We mainly work in Sitlingi Valley, but we also service the Kalrayan Hills and the Siteri Hills, where we run weekly clinics so that the people don't have to come here. They can also see us there and then get referred here.
The Tribal Health Initiative has improved not only the health of the tribals, but also their financial status and community well-being. Whether training tribal women to deliver health to their community, reviving tribal art, or forming a society of organic farmers, the couple has consistently strived to empower the tribal community that they chose to serve.
I think Tribal Health Initiative doesn't look at health in isolation. And when you think of health, you think of private sector and public sector. We don't think of the people's sector. There is a huge potential in people looking after themselves.
What we started on was the strengths that were here in the community, built upon that strength. And it is the collective effort of people, whether it be in the community health, whether it be in the organic farming initiative, and also the craft initiative which the women are doing in Purgai.
Through organic farming, we were able to persuade them to get into millets. And for us, millets is a big thing, because we think that going back to traditional foods is the only way that a society can become nutritionally sufficient, nutritionally independent. We have not seen child malnutrition and adult malnutrition and anemia for a long time now, because I think the key was to change that diet.
The Sitlingi Organic Farmers Association, SOFA, formed in 2008, trains farmers in organic farming. With turmeric, the main cash crop, the Sitlingi Organic Farmers Association also helps in marketing the crops.
Along with organic farming and profits coming in, I think the collective has a turnover of more than 1 crore now. So there's a lot of money going back into the villages.
இயற்கை விவசாயம் எங்களை எப்படி மாற்றுச்சுன்னா, நாங்கள் ஒரு குழுவாக அமைச்சாங்க ஹாஸ்பிட்டல் மூலிமா. அந்த குழு மூலிமா கொஞ்சம் கொஞ்சமாக பேசினாங்க எங்கிட்ட. இந்த மாதிரி நோயெலாம் நிறைய பேர்த்துக்கு, கர்ப்பிணிங்களுக்கு நிறைய நோய் வருது, குழந்தைங்களுக்கு நோய் வருது, இந்த மருந்து போடுறதுனால சாப்பிட்றதுனால நமக்கு நிறைய பிரச்சனை வருது, நம்ம இயற்கையில் மாறலாம் அப்படின்னு டாக்டர் அம்மாலாம் மீட்டிங்க்கு வந்தவா சொல்லும் எங்கிட்ட. சரி அப்படின்னா நாங்கள் மாறி பார்க்குறோம் அப்படின்ட்டு நாங்கள் செயற்கையிலேருந்து இயற்கைக்கு வந்தோம். வந்ததுலேருந்து எங்களுக்கு எந்த பிரச்சனையும் இல்லை, நாங்களே எல்லா பொருளாதாரமும் நாங்களே இது பண்ணிக்கிறோம். முன்ன சேலம் போயினோம் தான் எங்களுக்கு சிரமமாக இருந்துச்சு. அப்போ சேலத்துக்கு போனால் 2000 3000 தான், 5000க்குள்ளே தான் எங்களுக்கு மஞ்சள் ரேட்டு கிடச்சிச்சு. அப்புறம் நாங்கள் இயற்கையில் வந்ததுனால 6 7000 8000 இப்படி 9000க்கு 13000க்கு கூட போட்டுருக்குறோம்.
Under the brand Swasth, women entrepreneurs are given credits to make organic products using local produce. They make over 25 organic products, which includes powders of different grains like bajra and ragi, and millets and spices, helping them earn additional income.
2005 we started with just 4 farmers, And slowly the number were increased. The next year 16 farmers and 37 farmers. 2008 only we called all the 57 farmers. We found the name called the Sithilingi Organic Farmers Association. So right now we are working with 700 organic farmers and more than 2,500 acres we are cultivating organic farming. And parallelly we are working with the women entrepreneurs. Almost over 500 women entrepreneurs scattered in all the 21 hamlets.
The Tribal Craft Initiative enables local people to value their tradition and also allows them to bring money into the local economy.
Pargai Artisans Association is a society of artisans, artisan-owned society, artisan-run society. It is an independent livelihood option for them in the village. It is their happiness, their understanding their self-worth, which is very important for every person.
परगाई शुरू होके 15 साल हो गया. जो पहले हमको ये हमारा लंबाड़ी का एम्ब्रॉयडरिंग हम लोगों को मालूम नहीं. जो मैडम ने ललिता मैडम ने हमको ट्रेनिंग दिया, उसको बाद में ये हम सीखा. जो हमारे हाथ में पैसा रहता तो हमको कुछ चाहिए, कुछ लेना करना तो हम लोग अपना पैसा से ले लेते हैं.
Another one of the Tribal Health Initiative's beliefs is that good healthcare needs good governance, and that can only come at the panchayat level, local governance that is fair, transparent, non-corrupt and involved in the day-to-day aspects of people's lives. The Sithilingi Panchayat President, Madheshwari Manjunathan, is a trained senior nurse of 20 years. Not only did that help her manage the pandemic better, it also helps when she makes her daily village visits.
பஞ்சாயத்து தலைவர் கூட நிறைய இடத்துல வந்து பார்த்தீங்கன்னாக்கா பெண்கள் வந்துட்டு வீட்டில் பெண் தலைவர் வந்து வீட்டில் தான் இருப்பாங்க, ஆண்கள் தான் செயல்படுவாங்க. இப்போ இங்கே நம்ம வந்து ஒரு முன்மாதிரியாக இருக்கணும், பெண் தலைவர் வந்துட்டு நம்ம செயல்படணும். இப்போ ஆண்களுக்கு 50%, பெண்களுக்கு 50% கவர்மெண்ட் வந்து ஒதுக்கி இருக்குது. பெண்கள் வந்து செயல்படுறதுக்காக பெண்கள் வந்து முக்கியத்துவம் கொடுத்து நம்ம செயல்படணுன்றதுக்காக தான் அரசாங்கம் கொடுத்துருக்கு. அதை நம்ம ஒரு முன்மாதிரியாக இருக்கணுன்றதுக்காக தான் நம்ம ஒரு காமிச்சிருக்கிறோம்.
What was an impoverished tribal settlement ridden with superstition is now a financially, socially and politically empowered tribal community thanks to a couple who dared to live their dream nearly 30 years ago. It took a lot of hard work, but they are far from done.
Running a community health program which does not give you any returns, running a hospital at a level of secondary care where we do almost all the surgeries which are done in the cities. Now running that sort of a setup in the middle of the forest needs finances.
If one has to look at tribal health differently, I think one major thing is from the policy level, where it is not a policy which is made for the whole nation or whole state, but you have to listen to people's voices to each different area.
From training women in healthcare to forming societies in organic farming and handicraft, the couple has led from the front but has always got the community involved. A hospital that began in a hut was the beginning of the Tribal Health Initiative, but today it has made deep inroads in the lives and hearts of the people here, and today this is a secondary care hospital.